If you're watching this, you're probably in therapy and you're probably proud of it, right? Um, the question for today is, does it matter what kind of therapy are you doing? And the short answer is, it matters a damn whole lot. And today's episode is all about why it matters and what actually matters. And this is going to be a 3-part series, guys. So I've designed these 3 parts because time and time again, I've come across people who had been thinking that, I'm really working on this issue and I'm really working on this issue. And some of these people had been working on these issues for decades. And by simply switching to the right therapy for them, they were able to achieve more in 6 to 8 months to a year than they actually made in probably a decade or more. So prepare for this journey. We're going to explore in this first part how and why therapies are not the same and why it really, really matters what kind of therapy you're doing. And we're going to talk about knowing the end result. And we're going to talk about how much does your therapist know about, what you're doing, what he's doing. Does he have an end goal? Do you know that? Does he have a plan? Do you know that? Have you actually had these discussions? Should you know that? Should you be, up to date with all these things, or should you just be on autopilot and let him do everything and just go with the flow? So we're going to explore that. And also we're going to talk a little bit about some differences, but that's really the main topic for the next part in the series. So let's jump right in. So my name is Octavian Sbarna, and I'm going to be your host today. So let's dive right in. And first off the bat, we should be understanding that not all therapies are the same. And one broad category, one broad principle through which we're going to divide the categories of therapies is by approach, right? We have some coping therapies and we have some deeply healing therapies. Let's call the latter causative, right? Because they are after the cause. They want to heal the root. They want to get to the cause of it and actually do the healing to such a degree, to such a depth, so that they annihilate the cause of the disease and the disease is no more. Is no more for good, nor does it ever come back. That's what treating the cause of it, the diseases, or the root of the diseases. So we're going to call these causative or root treating therapies. And then there's a whole bunch of them which are mainly coping, right? They don't aim to root out the disease. They don't aim to heal them. They just aim to lessen the symptoms. And this is very, very important because you need to know what kind of therapy you're doing right now. So this part is for you guys that are already in therapy, and I hope that this episode will spring the right questions in your mind. That's one. And the other is for you guys that are considering entering a therapy and want to know more about what to look for in a therapy, in a therapist, and how do you know if you're pretty much in the right place. So this is a good starter for learning to ask the right questions. So let's talk a little bit about some examples of coping versus healing, or treating the symptom versus treating the root. It might be almost seeming like it's a no-brainer, and why do we speak of it? Actually, it's a no-brainer only in principle. It's like, if you ask a 5-year-old a very simple question, is it better to be a good person or is it better to be a bad person, right? It's kind of a no-brainer. Of course, most if not all, would say of course it's better to be a good person. It's better to be a good person rather than a bad person, right? And similarly, in this particular instance, it would seem, I hope, if you're watching this and you belong to this group that should be watching these videos, the answer should be kind of self-obvious. So would you rather treat the cause and eliminate the disease altogether, or would you prefer treating the symptoms perhaps all your life, right? So at a very superficial level, it might seem like a simple question, but actually it's not that simple, because it's like a rocket, right? It's very simple in principle. It's very complex when you apply it. Similarly with therapy, it's very simple in principle, but once you start to apply it in real life, it gets complicated real fast. So what do I mean by that? If we're talking about therapies that treat the root cause, number one, you need to understand what the root cause is. That's one of the biggest mysteries in medicine. And you can't treat the root cause if you don't know what the root cause is. You can't treat something that you don't understand. You can treat the symptoms of something that you don't understand, but you cannot treat the cause of it. Let me give you an example, right? So, Western medicine, very simple, very clear example of Western medicine. You get an infection. Let's say it's a bacterial infection. As the name implies, what's the cause of a bacterial infection? Let me think, bacteria, right? Wow, so what's the strong point of Western medicine? Antibiotics, yay, go antibiotics. So you swallow a bunch of antibiotics and you kill the damn bacteria. And the bacteria, the poor little things, they're gonna be crushed to bits. And poof, you're healed. Your urinary infection has simply disappeared. Isn't that a miracle? Welcome to 1929 and beyond. 1929, the year that antibiotics, namely penicillin, were discovered. So that's when a revolution started. And, we need to really acknowledge that. Antibiotics were probably one of the biggest revolutions in medical history. However, coming back to your urinary infection, your happiness might be short-lived, because yes, you've killed the damn bacteria, you're able to pee happily again, and then a month later, your urinary infection comes back. And off you go to the doctor again, right? And hello doctor, how are you? Well, I used to be good after the antibiotics, but now the infection is back. Can you please prescribe me some more? Yes, of course, let's do some tests. Let's see what this time it's about, meaning what kind of, microbes we're dealing with, what kind of bacteria, what are they sensitive to, meaning what kind of antibiotics we should give them. So we shoot them again with the same or another antibiotic and we kill them, or so we think, because hey, 3, 4, 5, 6, 7 days later you're whole again. You can pee happily ever after. Well, actually not ever after, because skip forward 1 month later and your infection comes back with a vengeance. Ladies and gentlemen, it's back. You see my point? If you've been unfortunate enough to be one of these people that I've actually described, because there's a whole bunch of them, you can understand why in actual practice, telling the difference between, treating the cause and treating the symptom is not so simple, right? Because it's not actually a 0 and a 1. It's actually a whole range of numbers versus a whole range of other numbers. So for example, you have a urinary infection. What is a symptomatic treatment? What is a causative or root kind of treatment? You might be, inclined to be thinking, well, I'm going to take some anti-inflammatory drugs, and these are sure to help with the inflammation locally, and that's symptomatic. I'm also going to do some some local washes with some, whatever solutions of whatever kind, and they're also meant to help somewhat. So that's also symptomatic, right? But the real thing that gets to the root cause of it is going to be the antibiotic. If you treat it once, twice, 300, 500, 10,000 times, and you're still on the antibiotic, if you know what I mean, blip, 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 guess what? Do you have a feeling that maybe you're not getting to the root cause? Well, if that is the case, ladies and gentlemen, you are right. So here is where the approach in TCM, or in Chinese medicine, right? TCM, traditional Chinese medicine, comes with a little bit more background. It's like a step back, and let's see the actual cause of it. And here it gets really fascinating really quick, because in Chinese medicine, we have an understanding that things can happen on a multitude of levels. So we can have physical causes, we can have emotional causes, we can have mental causes, we can have spiritual causes for the same disease. So for example, a physical cause of urinary infection, it could be that your kidney or bladder energy are weak. So that's a simple fact, right? This could be because you've been born with a weak kidney energy, right? It's like inherited, right? So a series of treatments that will boost your kidney energy and your bladder energy should solve the cause and the symptoms. That's a physical level approach. Let's say an emotional level approach, right? An emotional level approach could be, often is in my experience, let's say the typical example of that would be a woman who has just gotten into a new relationship after getting out of a toxic relationship, or perhaps a series of toxic relationships. Now pay attention, because this might be the story in which you recognize yourself in this, right? So pay attention to this, ladies, right? So you've gotten out of a series of toxic relationships, one which was worse than the other, or maybe a little bit better, but and then you get into a really nice relationship and you meet this nice guy, and oh my God, he's so a whole new level. And even the sex is wonderful, but the only thing that makes it a little bit bad is that every time you seem to really be enjoying sex, every time you seem to really be enjoying intimacy in all its depth and dimensions and everything, like, emotional, physical, spiritual, everything, you pop a urinary infection. Out it comes. So it's as if every time you really seem to enjoy life, a urinary infection comes up. And when I say enjoy life, I mean the couple life, the sexual life. Now, of course, any doctors would say, well, maybe there's a bacteria that you two are sharing, maybe, but the both of you should be taking antibiotics. Of course, yes, maybe you've been there. I know many patients who have. So you take the antibiotics, both of you, right? You go through all the battery of tests, you do everything textbook, right? You take everything, all the medicine, all the antibiotics that are prescribed to you. So what are you going to do? Maybe it's going to go away. And then you really are free to enjoy sex, or so you think, until it pops back again, right? If this seems familiar, this is especially for you. Or maybe you know someone who seems familiar. You know someone whose story seems similar to this one, right? Okay. Now, this is just an example on the emotional level, and of course I'm going to explain to you what the emotional link is, but this is just one out of many, 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 many possible examples. So in this case, the most common explanation, the most common mechanism is, and side note, I hope that you're going to start to see the difference in thinking, whereby we actually start to understand the difference between causative approach, treating the root, versus symptomatic approach, treating the symptom or the manifestation, right? Closing of the side note. So the mechanism, the psychological mechanism is, I am a woman who is used to being abused in relationships, to being unhappy, had a childhood with a father that was pretty much a mixture between fairly cold and distant, not being physically or emotionally available, and usually when he was a little bit critical, which of course cultivated a self-image of I'm not being good enough. Again, does this ring a bell? Okay, so you attract the kind of dynamic that seems familiar to you. You attract the kind of partner that seems familiar to the dynamic that you had with your father. That means you're gonna attract some pretty not so nice guys, okay? And finally, once you do get a break, or so it seems, right? You get these things. Why? Because very deep down, inside, you feel that A, you're not worth it, you're really not worth it. Now, of course, some of you may be thinking, no, that's not it. I know I'm worth it. I really know. Yeah. Do you know here? Do you know rationally, or do you actually feel it? Because it's not about knowing rationally. This is not about the mind. This is about the emotion. This is about how you feel about yourself in your subconscious. And this is not a game we play. This is not me telling you that it's like this or it's like that, and you arguing that it's not like that. This is how things are. We as therapists guide ourselves by what the body also tells us. The dynamic also tells us. So if you've been gravitating from one toxic relationship to another toxic relationship, trust me, you don't feel you deserve a better one, right? Now, there may of course be other causes as well, but I can guarantee you that this is also one of the main ingredients in that equation. So you may not feel that you're worth it, A. B, you may feel that real, nourishing, deeply fulfilling intimacy is something so out of a fairy tale amazing that it is so scary. It is so scary, because deep down you've always wanted it, you've always desired it, you've pinned your strongest, biggest, most important aspirations on that. And when it actually happens, it's almost too good to be true. So you need to guard yourself. You need to, break, take a little break, take a little pause, breathe, and figure out if this is actually happening to you, if this is actually real, because you've been there before when you've opened yourself up and you've been hurt, and it hurt like hell. So of course you don't want to have your heart trashed again. So what do? Well, nothing consciously. Consciously you're there and you really want to enjoy it. The relationship, the intimacy and sex, and then the urinary infection comes back. You know what? Ironically, the urinary infection is there to guard you. But it's there to guard you in a kind of a misunderstanding way, right? It wants to guard you because a part of you thinks that you're exposing yourself to something that is very dangerous. Your previous experiences with intimacy have shown that it does not end well. Okay, so maybe you don't go all in. Maybe you keep a little bit of a distance, right? So that's what you do. And how do you do it? Well, you don't let yourself get accustomed to having good, nice sex all the time, or good, nice intimacy, or open your heart fully, right? So your body creates various obstacles. It can be a urinary infection, right? So I hope you realize that this urinary infection thing is just an example I chose. And what do you do if this is the case? Now, if all this seems similar, if you've heard about this, or you know someone who's going through this or has gone through this, try and put this together with antibiotics. What do you think, what do you imagine antibiotics would do in such a case? They wouldn't be anywhere near. They wouldn't be even in the same universe as having anything to do with the real cause of what is happening, right? And if you think that, the body doesn't have the power to do these things, even Western medicine fully admits that there is such a thing as somatization. That is emotions causing physical illness, right? There's no doubt, even in the medical community, in the Western medical community, there's no doubt that this is a real thing. And this is how things happen. And how do I know about this? Well, I treat them. I am speaking to you not out of a fairy tale. I'm speaking to you with this example because I've seen this pattern that I'm describing to you again and again and again and again, right? So you need to be aware of the fact that there are some therapies which are better suited than others to treat the cause and others to treat the symptom. And I don't mean to minimize the importance of treating symptoms. I am not by any means against antibiotics. What I am against is confusion. What you should be doing is promote clarity, understand what approach is designed to do what, right? Because if you're, in this particular case, in this particular example, if you're aiming to treat the cause, understanding everything that I just told you, with antibiotics, they don't meet, right? The cause is emotional. Antibiotics will only solve the manifestation, and it's going to come back again and again and again and again. Now, if you've been through all this, now you understand why. Now you understand what I mean, right? So that's the problem. That's where things go sideways. Now, having said that, once you do know what to do and you are treating the cause, by all means take something for the symptoms too, if it's necessary. Why would it be necessary? You might be thinking. And this again comes back to the fact that in practice, the difference between causative and symptomatic treatments is so much more complex than just in theory. When in practice we do treatments, and even in acupuncture, even in Chinese medicine, we can do treatments that are aiming for the root cause, and we do treatments that are aiming to relieve symptoms. So even here, when we do treatments to address the cause, what happens most of the time is that it's a long process, because the process is, when we speak especially about the deeper causes, like the emotional cause, the mental, the spiritual is deepest and widest and longest of them all. But and I'm not going to explain in this video what the differences are between these. So if you want me to, just write them down in the comments, and maybe I'll make a video of these differences. But suffice to say that these levels, these higher than physical levels, are long and complex and deep, and they take a lot of time because you need to process what's going on there. So what happens is that when we do a root cause, a root treatment, right, what we're doing, we're entering into this processing game, and we're helping the body to activate some inner emotional resources so that it's able to process various emotions that have been repressed. And there's a whole emotional digestion process that starts to happen. And it's not pretty, and it's not comfortable, and it's gonna make you face your demons and face the unfinished chapters in your life, right? Hey, if it were pretty, you'd have done this before, right? The reason why we have repressed emotions is that they're not pretty, right? Actually, we only repress emotions when they're so not pretty that we feel overwhelmed if we were to expose ourselves to them. So, by the way, how does an acupuncture treatment work? Very broadly, when it comes to dealing with emotions, it activates emotional resources that are already there in your psyche. And they're just latent, like a seed. They just need to be activated, and it happens, right? So that's what we do when we treat causatively. So again, when we treat causatively, a hell of a storm is gonna come up, right? So then we need to treat symptomatically. And by the way, when I say causatively or symptomatically, I don't necessarily refer to physical symptoms. It can be treating emotional parts as well. If we treat a depression or an anxiety, we can treat it symptomatically, and there are treatments even in acupuncture that are very calming and very soothing, and you're going to feel a calming effect. But they're not deep, right? They're not going to last, and you're not going to get very far with them, right? So you need the deeper treatments that actually address the cause, and that's a longer, more winding path. And you're going to have to face your demons. So it's going to stir some shit up. That's the plain truth. You can't skip that, right? But that's what makes you stronger. And you're not simply facing the same demon again. You're facing the same demon with resources that you didn't have before. And who decides that you have enough resources? Your subconscious. Because he's not going to open up the gates of hell unless and until your psyche, subconsciously, knows you have enough emotional resources to face those very difficult chapters and actually be able to process them and come out on the other side. So once we do such a treatment, then maybe with everything that's going to be stirred up, then you need some symptomatic treatment, because all that is going to be stirred up and you need something more superficial to help you clear all that out, right? So after the superficial treatment, that's when you actually feel the release, right? And that's where the root cause treatments and the symptomatic treatments make a very good couple together, and they deliver the results. They treat the cause and the symptom, and when you've completed such a loop, you're one step closer to true, real, deep healing. Why do I say true deep healing? Because once this deep healing is completed, it's irreversible, right? You're not going to need to treat it again. Unless, of course, what you're treating is something that is derived out of something that you are causing, right? If you're overworking, yes, you can treat, burnout. But if you're going to do it again, of course, you're going to come back in the same state, right? So it's not about that. So we've discussed this, coping versus symptomatic treatment. So, conclusion to this part is you need to understand what kind of treatment you're doing. So feel free to really interview your therapist. What is it you want to achieve? What is the end result of your therapy? It's been absolutely mind-boggling to me to find out just how many patients did not know how to answer this very simple question. So I've encountered countless patients who were saying, I've been doing therapy for, years and years and years and years and years. And I asked them, so what were your objectives? Well, I went there for anxiety. No. Okay, I understand. I understand the presenting symptom. But in therapy, right, did you and your therapist set out some, objectives along the way? What are you aiming to achieve? An amazing number of people have no idea. And then it's kind of, then you get into the trap of, I'm doing therapy. I am in therapy. Okay, so what are you doing? Where are you going to be in 6 months' time or a year time? Or what are you working on now? What are you aiming to achieve now? Believe it or not, therapy, just like most other things in life, should have some organization. There is space for free flow, don't get me wrong. There are entire therapy approaches, like for example Gestalt, in which, by the way, I've also been trained, so I know it very well, which wholly rely on the free flow of working with whatever presents itself. But having said that, there is still an underlying understanding of what we want to achieve. Okay, the method could be free flow, but still there are some objectives. And you, as the patient being the most important part in the therapeutic team, you should know what your end results should be. So again, I see too many people who have this kind of thing in their mind, and they call it, I'm working on it. I've almost developed an allergy to the idea that I'm working on it. And the reason that I have almost an allergy to the idea that I'm working on it is because most of the time this phrase is used by people who aren't even in any kind of therapy. What they mean to say when they say I'm working on it is actually I'm aware of the problem and I have it somewhere in the back of my mind. And they think that by just having it somewhere in the back of their mind, it's somehow magically going to disappear someday because they're aware of it. Guys, it makes me angry to see such naivety. And it's honest. I see people who truly believe that they are working on it. You're not. Guys, you're not. Would you have a business plan if you run a business? Would you have objectives for that business? Of course you would. Guess what? Therapy isn't all that different, right? So you need to have an end result. So if you're in therapy now, I advise you, have a discussion with your therapist and have a plan. What are you trying to achieve? How long is it going to take? What steps does it entail? How much of it is addressing the root cause and how much of it is addressing just the symptom? By the way, I don't know if you know, another surprise to me has been that some therapists, they don't even understand what the therapy that they're actually practicing. Yeah, you're hearing me right when I say this. They, as therapists, don't know what the therapy that they are practicing with and on patients is supposed to be doing. They're simply immersed, aimlessly, somehow artistically floating in an undefined therapeutic approach or endeavor. And luckily enough, the success of a lot of therapy is based on a good relationship, right? So relationships heal, connection heals. Be that as it may, guys, there's a lot more to therapy than just good connection and being listened to by the therapist. You need to take that into account. Therapy is much more than just being listened to. Just the other day, I was having a conversation with a patient who was telling me that she goes to the therapist, and so I was asking her, so what did you achieve? What did you do? What was the approach? And she told me, well, every time I go there, it's kind of like the same. And, I unwind and I express everything that I wanted to express because there's very little room for me in my life for me to do that. So that's the only place where I can actually really say everything that I want to say. Fair enough. Is it positive? Yes, of course. There's no question about it, right? Is this everything therapy should be? No. The reason why I'm doing all of this video right now that you're watching is because too often I've seen people in this position yearning for a deeper change and thinking, oh, why am I not getting there? Why am I getting all the signs in my life that somehow it's not enough? How do I know it's not enough? Well, I find myself in the same shitty relationship dynamics. Why? Because deep down in my subconscious, something is not actually healing. Maybe part of therapy doesn't even get there. So if it doesn't get there, how could I actually be healing? I'm not healing, but I think I'm healing. I think I'm doing enough. And guys, you are patients, right? It's not necessarily your job to know the nitty-gritty of the therapy because, when you want to build a house for yourselves, you don't need to become a constructor and an engineer and an architect. It's impossible, right? You don't need to be the expert, but you need to know enough about how to ask the relevant questions to the expert that you're delegating this, you're outsourcing this to, so that you know that they're doing the right job and you know that you are asking the right questions and you know what to look for that is going to be a sure sign of success or failure in a certain amount of time, right? So if you're going to the therapist to just speak and express everything that you want to express, that's a very little tiny percentage of what therapy is. Why is that? Because Even if that is a very important part of therapy. And again, please don't get me wrong. I'm not against venting out when in therapy. It's so important that empathic listening is part of this, and that you as a patient feel that you are actually listened to. That's immensely important. And sometimes it's vital that a therapist listen to you, sometimes maybe for months on end, right? Some key therapy is really triggered by the fact that somebody is really 100% there for you. And I totally respect that. But, and this is the big but, right? It's one thing when the therapist does this on purpose, fitting this approach into a bigger image in which he or she knows, okay, so in this part, in this phase of therapy, this is what we're doing because we aim to cultivate a better relationship with the person. We want to transmit to them that they are worthy of attention, they are worthy of being listened to. We honor their existence. Yes, that's very fine and dandy. That cannot be 100% of the therapy. Not for most people. It's important, yes. It's wonderful, magnificent. Is it enough? Nowhere near, right? Nowhere near. Because this, again, needs different other ingredients. It's like, do you love food? Of course you love food. What if you had a whole restaurant of the best food you can imagine? Could you actually live in a Michelin restaurant? Yes. Without water? No. You need water. No matter how good the food is, you also need other stuff, right? So it's the same thing with this, right? For example, many patients that I encounter don't understand when they go to therapy, actually, right? They are in therapy, and I ask them, so what's the, what are you doing? What kind of therapy are you doing? I don't know, psychology, psychotherapy, maybe, I don't know. So it's very clear that they actually don't know what they're doing. So I understand. So what is this therapist's formation, right? What style of whatever he's doing is he doing? Is he a psychologist? Is he a psychiatrist? Is he a psychotherapist? Do you know the difference between these three? I mean, it's like, do you want to go to New York? Do you want to go to London? Do you want to go to Tokyo? You can't just go west and wing it, right? You need to have a pretty accurate address, right? So, by the way, guys, psychologist is the guy or girl who has actually studied at university psychology. Is he entitled to treat you? No, he is not. He's not. Or she's not, right? You need additional degrees for that. As in clinical psychology, yes, but that's an add-on to actually psychology, right? And by the way, psychology is very different from psychotherapy because, as the name implies, psychotherapy is much more geared towards actually treating the stuff, whereas psychology is more to, logi, Latin for science, understanding, right? So one is more generic, aimed at understanding, and not understanding you, the patient, but actually understanding the mechanisms. That's what psychology does. Psychotherapy is, as the name implies, a therapy. So that's where the dialogue with your therapist happens. And then we have psychiatry, which means I don't fucking care what you have. Here are some pills. Don't annoy me anymore. Come back in a month's time and we'll see how crazy you are then. And maybe I increase your dosage. That's psychiatry, right? Psychiatry really is not for the benefit of you as a patient. This is a personal opinion, right? Psychiatry is more for the benefit of society because you're going to be a little bit numbed down so that you don't cause a mess. That's the plain reality, I think. Now, that is just in most of the cases, okay? That's not in 100% of the cases, and I have met on occasion psychiatrists which are absolutely geniuses. And what I mean by that, I mean that I totally respect them as human beings because the right approach to psychiatry, unfortunately, it's not very common, but the right approach to psychiatry is, hey, you're overwhelmed by all these things. Here are some pills. They are meant to decrease the suffering to a level that is okay for you. Use that wisely and go into psychotherapy or whatever other form of treatment that is going to balance out your emotions, like for example emotional acupuncture. And then, maybe as you heal stuff, you're going to be stable enough so that we decrease the medication and finally wean you off it. And then, yes, healing, right? So psychiatry is the actual medical science that is designed not as a root treating approach, but as a symptomatic approach. But here is where the confusion happens, because a lot of people just take antidepressants or anxiety medication because they don't want to treat the cause. They're not really interested in getting down into the depths of their dark soul, and they just want to get it over with, right? But that's just covering up the shit. That's the, very bare naked truth. So that's the difference between psychiatry and psychotherapy. So for example, between those two, there's no shame in understanding what is the place for each, because they have, team skills. They should be working as a team. Any medicine, any medical approach should be working by having a very complementary approach to root cause and treatment, right? So symptomatic treatment and root cause, treating the root cause. So these two need to be balanced out. Sometimes the symptoms are too strong. You need something symptomatic to make room for other treatments, other approaches to address the cause. Sometimes it's not something that is, urgent. It's not something that is immediately attention seeking. It's just the nuisance of something coming back again and again and again, and you just want to get down to the root to address it. So then you start directly with the root approach and you address it, right? But every time you need to understand what instrument is designed to do what. That is the whole point. So I hope that you've come out of this with a better understanding of it, and I hope that you've taken something out of it and maybe some good, interesting questions for when you go to therapy, or now at least you know what to search on Google, right? And in next episode, we're going to talk about what are the key differences between actual therapies, right? What kind of therapies are deep? What kind of therapies are shallow? So if you found this interesting, in the next episode, we actually deep dive with actual kinds of therapies and we discuss them, and we're going to talk about the differences between them. So stay tuned. I'll see you in the next video. And of course, if you found this interesting, don't forget to share and, subscribe, like, you know what to do. I'll see you in the next episode.